Seeing and hearing some of the things that they've been through is hard. And I'm a mom. So when a child says, "Thank you for keeping me safe," it's hard.
Child welfare is a tough business. Our teammates are involved in people's lives at some of the worst times. They need to make hard decisions. They see and experience terrible things. That's why when we were chosen to participate in the QIC WD program, we looked hard at what we could do to support our team, to help those who help others live better lives. Our intervention is focused on secondary traumatic stress, its impact on our workforce, our teammates, and our people.
The CFS Strong intervention is focused on 3 components. The first is prevention and building skills related to resilience and optimism. The second is a debriefing model that when a traumatic event occurs, that there is a support system for people to discuss their experiences and continue to build resiliency around that. And the final piece is a peer support group that will continue to do the skill building and have sessions to meet monthly and discuss what's happening in the workers' lives and the supervisors.
Especially towards the beginning of drug court cases, they're in full use, full addiction, and that's really hard to see families like that, especially when the parents are so in that use that they don't show up to visits or anything like that, and seeing the impact on their kids. That's probably one of the worst parts of this job.
For a new worker, brand new, never had a caseload before, given 10 cases, and the phone starts ringing, and the attorneys start calling and emailing, and your time frames are coming. It's a lot. It is a lot.
I've had people who sit next to me that are like, "I can't do this job anymore," and they're almost in tears. I've had people tell me they're taking a week off and I need to just go away to somewhere else and take a trip and get away from my cases and not think about it and let somebody else think about it for a week. I've had people break down in my car when we go out to lunch together because they just can't handle it.
We have a theory of change that kind of spells out how we get from the intervention to short-term outcomes, intermediate outcomes, and then the long-term outcomes of increased retention, reduced turnover, and increased positive outcomes with children and families. So what we're hoping to see with this intervention is increases in resilience and optimism, decreases in burnout and secondary traumatic stress levels, and increases in job satisfaction and organizational commitment. And if we see those things, then we hope that will lead to decreased intent to leave, we call it. So basically feeling like you might be looking for a new job or feeling like you might quit your current job. And then if we see decreases in intent to leave, then we would hope that more people would stay. And we hope that having people stay increases positive outcomes for children and families, because we know that workers who have been in the field for a little bit longer sometimes have more consistent decision making.
And our hope is, through this study and these interventions, life will be better for our teammates and for the families and children they serve. We cannot stop secondary traumatic stress, but we can build an environment where people who are taking care of people are also taken care of. A culture where we are CFS strong.